So, we've all just been through a massive global health crisis. But how on earth did something as scientific as a vaccine become one of the most political and divisive topics out there? Well, today, we're going to break down exactly how public health got so polarized and what experts think we can actually do about it.
Yeah, this is really the big question, isn't it? Because the COVID-19 pandemic, it wasn't just a challenge for scientists in a lab. Nope. It quickly became a major test of our entire social and political fabric. And if you can understand that shift, from a health issue to a political one, you'll get the key to everything we're about to talk about. The pandemic really ripped the curtain back on this divide. By 2021, vaccines were out there, they were widely available, but the data started showing something really interesting. A person's decision to get one, it wasn't just about their health. There was another really powerful factor at play. And what was that powerful new factor? You guessed it, politics. Research published in The Lancet found this incredibly clear correlation. The areas with the lowest vaccination rates were, overwhelmingly, Republican-leaning states and counties. All of a sudden, a public health decision became one of the single strongest predictors of how someone voted. Wild, right?
And look, the stakes here are unbelievably high. Experts immediately started warning that this wasn't just about COVID-19. The real fear, the big one, is that this polarization could spill over and start eroding trust in all routine immunizations, threatening decades of progress against stuff like measles, mumps, and polio.
So how did we even get here? I know it's easy to point the finger at the pandemic, but the truth is, COVID-19 didn't create this movement out of thin air. It was more like gasoline on a fire that had been smoldering for decades.
To really get it, researchers say you have to look at three distinct waves, or, generations, of the modern anti-vaccine movement. Each one was sparked by a different fear, and each one built right on top of the last. Okay, so first you have the 70s, with fears around the pertussis vaccine. Then, in the 90s, things really exploded with that infamous and totally debunked claim linking the MMR vaccine to autism. But this third wave, the one we're living in right now, it's a completely different beast. It's less about a specific vaccine or disease and so much more about a political ideology, this idea of health freedom versus the good of the community. And that big pivot towards ideology, that wasn't an accident. Oh no. It was a very deliberate strategy that transformed what was once a fringe movement into an organized, highly networked, and politically powerful force. And here's where their playbook got so effective. The movement shifted its messaging away from specific health claims, the kinds of things you can argue with facts and data, to the much more powerful language of medical freedom and parental rights. And honestly, that was a brilliant move, because it threw the doors wide open to anyone with conservative or libertarian views about government overreach. And this new messaging, it was backed by some serious organizing. Things really kicked off around 2015 in California, where activists began to explicitly align with right-wing politics. They formed actual political action committees, they totally mastered social media to build these national networks, and they even started targeting and harassing health professionals. This entire political machine, it was built and running long before anyone had ever heard of COVID-19. So the groundwork was all there. And then the pandemic hit. And like I said, it didn't create the movement, but man, it was the perfect storm to supercharge it, launching it from the fringes right into the mainstream. I mean, just think about it for a second. Suddenly, the entire planet was talking about vaccines. This gave activists a massive built-in audience that was already scared, desperately looking for answers, and pretty frustrated by things like lockdowns and mask mandates. It was a captive audience. So how did this message get amplified so effectively? Well, it came down to a shockingly small number of people. Get this, just 12 influencers. They were dubbed the Disinformation Dozen, were responsible for as much as 65% of all the anti-vaccine misinformation online. A tiny group with an absolutely massive impact. And their campaign? It wasn't one size fits all. It was surgically precise. They tailored their messages, exploiting historical injustices like the Tuskegee study to sow mistrust in Black communities. They stoked fears about fertility to target women. This was a really sophisticated, multi-pronged effort to find and widen every single crack that already existed in public trust.
Okay, so if that's how we got into this mess, how do we find a way out? Well, experts are pretty clear on one thing. You cannot fight a highly coordinated movement with a disorganized, piecemeal response.
The path forward has to be just as strategic.
One of the coolest new strategies is something they're calling pre-bunking. The idea is basically like a vaccine against misinformation itself. By showing people the tactics that are used to mislead them ahead of time, they get way better at spotting and dismissing false narratives when they see them out in the wild.
But the bigger solution, it's going to take what experts call a whole-of-society approach. So, step 1, build real networks of trusted local messengers. We're talking pastors, barbers, community leaders who can all share facts at the same time. Step 2, bring in a wider range of experts, not just doctors, but people from communications and behavioral science. And finally, step 3, use this new powerful network to reclaim the narrative of freedom for community health and to stand up for the health workers on the front lines.
Building on that, experts have laid out 4 key actions for our leaders. First, diversify the messengers. Let's hear pro-vaccine voices from every political background. Second, invest in the research to truly understand why people believe what they do. Third, use legal and regulatory tools to go after these big, organized disinformation campaigns. And finally, and this is a big one, demand that media outlets and advertisers stop amplifying and profiting from the spread of dangerous falsehoods.
When you really boil it all down, the core challenge is this. The anti-vaccine campaigns are highly coordinated national networks, but the public health response? It's often scattered, disconnected, and just not working together. And you simply cannot fight a network with a bunch of isolated voices. You need a network to fight a network.
And that leaves us with one final and really critical question. Because this whole battle over vaccines, it's not just about medicine anymore. It's a symptom of a society that is struggling with the very idea of trust and truth. So the real challenge for all of us is, in an age that's basically designed to tear them apart, how do we start rebuilding a foundation of shared facts?